Well, good morning, and I do appreciate the wonderful words of Senator Fetter. I am Judy Wolf, if anyone has just come in. I'm delighted to welcome you to the State House this morning. As the Ohio State Public Affairs Chair of National Council of Jewish Women, we are proud to serve as a convening organization for the Coalition for Family Health. We, along with 31 other organizations from across the state, have come together to raise our voices together. That's the important thing, 31 of us together, in support of the Ohio families. And we represent such a large geographical area. We cover the entire state. The Coalition for Family Health launched 1 year ago in this very room. Our 31 members represent rural, urban, and suburban Ohio and encompass everyone from organizations that serve a whole statewide constituency to those who operate in a single neighborhood. Together, we intend to impact policy and improve the lives of women and children by ensuring their access to services, products, and education that are vital to their own health and their well-being. Our immediate objective is the passage of the Ohio Prevention First Act, a landmark piece of legislation that has bipartisan support and the will of the people of Ohio behind it. Prevention First offers that practical, viable antidote to the epidemic of unintended pregnancies. It offers affordable birth control and appropriate health education. It encourages responsible behavior. Prevention First will reduce teen pregnancy, and it will save taxpayers money in doing that. The Coalition for Family Health is committed to the passage of the Ohio Prevention First Act. Indeed, 1 year later, we are larger, we are stronger, and we are incredibly dedicated. This morning, we are pleased to release the second in what we hope will be a series of coalition white papers. The report on access for family planning resources in Ohio should be a wake-up call for anyone who is still asleep about this issue. And the report is in your press kit or in the materials you got, but we also have a wonderful website, www.coalitionforfamilyhealth.org, and that's mentioned in all of your materials. But not only are all the areas of Prevention First outlined there for you, but you can keep up to date on what is happening. So you can get the white paper there. You can also if you look at it a month from now, it will be updated. So we want you to be aware of the website. Ohio is among the worst states in the nation in terms of access to family planning. We spend less, significantly less, on making resources available than so many other states. And perhaps not surprisingly, unintended pregnancies currently account for 1/2 of all Ohio births. That's just not something we can have here. Crystal Ward Allen, who wrote the white papers forward, is here with us today. Crystal, for those who don't know her, is the Executive Director of the Public Children's Service Association of Ohio, and someone whose experience and expertise are unmatched and so valuable to the coalition.
Well, thank you so much, Judy. I really appreciate that, and I feel very honored to have such an introduction. PCSAO, Public Children's Services Association of Ohio, represents all of the county child protection agencies throughout the state. Our mission is all about safe children, stable families, and supportive communities. And I can tell you that making sure that children are wanted and intended is the first step to having safe children and stable, supportive families. Few would argue that one of the most important decisions in life is when and with whom to have a child. It's best done with intention, thoughtfulness, and joy. As outlined, about half of all births in Ohio are the result of unintended pregnancies, and the resulting financial cost to government is very great. The private health insurance is very great, and I can tell you the outcomes for children, in my opinion, is even greater than the financial cost. Working with the child protection system, I have a target audience. We have the professionals working with children and families. We have the families involved in the system. We have the youth involved in at-home care. Some of the outcomes that we know: about a third of all open child welfare cases had children born to teen parents. They are unprepared, and it's very stressful being a parent when you're unprepared. Children born to teen parents are much more likely to be reported to the child protection system. So we have further involvement there. Children who were born to teen parents are more likely to become foster children themselves. And that creates a whole slew of outcomes for children that is stressful. Children who age out of our system, the transitioning youth who age out of foster care, they're 2.5 times more likely to become pregnant as teenagers than regular youth. You can just see how the circle continues. And this is one of the reasons that I am really pleased to be part of the Family Coalition, the Family Coalition for Family Health, and really be focusing on prevention. I think that's where we have to start, whether it's child abuse prevention, whether it's teen pregnancy and unintended pregnancy prevention. These are all strategies for safe children and stable, strong families. The good news is there is a lot of good stuff going on right now. We do have this legislation, a number of bills that are just exciting, and I can't support the Prevention First bill more. As you know, Governor Strickland hosted an anti-poverty task force about a couple years ago. One of their first recommendations was Ohio needed a Medicaid family planning waiver, as do 27 other states already have one. The Medicaid family planning waiver provides $4 in savings for every dollar spent. I mean, that's significant. If we don't care about the health of children, we certainly care about dollars that are invested here in Ohio, the cost. We have a lot of science. We are starting to get evaluations from pregnancy prevention, teen pregnancy prevention and unintended pregnancy prevention programs. And that's kind of new for our field, to start having some evaluation in science and know what works. This is a centrist issue. It is not partisan. It is not conservative versus liberal. This is an issue about values that I think everyone in the state of Ohio embraces. Preventing unwanted pregnancies, having safe children and strong families. We also have a whole number of new materials that I'm really pleased with. National Campaign to Prevent Teen Pregnancy has just did a whole series of materials specifically for foster youth and professionals working with children in the child welfare system. That's just one of many sets of materials that are now available. Senator Feynman.
How are you?
We're talking about preventing teen and unintended pregnancies. Carry that message with you today.
I carry it with me everywhere.
I think most importantly is I'm hoping we have arrived at a point where we realize that we don't have to be polarized. We don't have to talk about abstinence only versus sex education. We're talking about comprehensive education. And that's not just about biology. It's not just about contraception. It's about messages. And this is where I get to my mom's stance. Teens need to hear things like abstain and delay during the teen years. Teens need to hear things like, think about what you're doing. You need to be having a relationship and negotiation and communication skills. Teens need to be doing some advanced planning for what happens when they go to that party and everybody's drinking and somebody says, let's go on upstairs. I mean, these are things that aren't just about science, medical, biology. They're about critical thinking skills for teens. And I think that I'm really happy that we've arrived at a place where we're talking about a comprehensive package for sex education and teen and unintended pregnancy prevention. And I see this as something that we are going to have a strong support from every angle on, because I never talk to any policymakers that don't believe in these types of things. So I just want to say thank you. I'm really pleased to be part of this, and I'm looking forward to a lot of